Liz, and we today are doing another one. And this nose has 3 or 4 essential features we want to go over. Number 1, an asymmetric hump. So yes, she has the dorsal hump, but it's not just a hump, it's asymmetric. It curves to the left side. She was probably at some point bumped on this side of the nose, maybe when you were a kid, got a little bump there. So bulging of the dorsal hump to the left. We have typtosis. There is a very flat collapsible columella, so her columella is short. She has a polybeak deformity. We can see that the cartilage protrudes here and causes a downward hooking of the nose. So when she smiles, go ahead and smile, the tip hooks down even more. Muscles pull downward, the traction on the nose causes a worsening of the polybeak, and she really notices that. Her nose is also lengthened, so the overall length is long and hanging. So those are the difficult problems we're going to work on today. I'm going to show you how. Let's start with marking the nose, and I always think, like a surgeon, think about your nasal bones, the upper third of the nose, that's where the dorsal nasal arteries will come in. We can even mark where her nasal bones are, just in our mind's eye. It helps us determine where we have symmetry, where we have asymmetry. So the nasal bones end right about here, and I can kind of feel that with that little inset there. And the junction of the nasal bones with the cartilage here, the cartilage hump, is called the rhinion. This is the radix up here. This is going to be the rhinion down here. She has this asymmetrical hump. You can see it bulges more on this side, right, versus on this side. So we're just outlining that so our brain can see it. And then below that upper third, the middle vault of the nose then, is the soft cartilage. And that comes all the way down to here. It's important to assess how light hits in this area because she has a large cartilaginous hump here and here. So if we were in surgery, we'd be shaving this off, shaving that off, making sure we took more on this side. We can't do any of that here. This is not subtraction, this is addition. And we're going to think about where to add volume to create a beautiful line of dorsal. The dorsal nasal aesthetic line has got to come down straight. So we can see it's going to curve this way. Actually, I'm going to draw that with a different color pencil. Let me go back to now the lower third of the nose. I'm going to pinch the nose upwards and take a look at the lower lateral cartilages. Those cartilages are arches that form here, come down the middle, and also in here and go down the middle. Alright, so that is a good outline of upper, middle, lower third of the nose. We also look at the base of the nose because sometimes there's asymmetries down here. Nostrils might look irregular, the columella might pull left or pull right. She looks fairly symmetrical down the columella, but it's very short and compressed. From here to here is a tiny columella, so if anything, sometimes we'll do a strut of vertical support right in there. And lastly, we can do a little nasal pliability pinch testing. Pinch in here, and we can see the skin is pliable and there's room for filler. Close your eyes for a minute. We can pinch down here and feel that the columella, it has pliability, but there's very little room for filler. It's actually quite tight in there. When I pinch the tip and pull upwards, turn, and I want to position in my mind's eye where the tip of the nose is going to go, there is also pliability here and room for a bolus of filler. So she's a good candidate for liquid rhino based on the pliability, based on the shaping, and based on what we're going to do there. I'm going to get a different color pencil and I'm going to show you the dorsal aesthetic lines that we're going to do so you can think about where to place the filler. So starting at the eyebrow arch and coming in downwards, we want to create a little more line of definition here to hide that gap. We want to come all the way down to the tip, just like that. So this is showing me where I have areas that I need to fill. And here, we're going to need to fill. The dorsal aesthetic line is where light is going to hit her. And doing this procedure with liquid rhinos is really all about creating a light reflex, because I can't subtract bone and cartilage unless I'm in the operating room. And so I'm kind of outlining where I want the filler to be placed to get the best results here, to create the illusion that it's straighter than it actually is and that it's narrower and kind of perkier than it actually is. So I can see right off the bat that I'm going to have to place some volume here and here to hide the hump and hide these little bony protrusions, the bony spurs. In here where the nasal bones pinch, and there's collapse of that lateral nasal vault. Right in here we're going to add some volume. This is a danger zone. And then here at the tip where the cartilage, let's see, there's also a middle light reflex, and you can kind of see where it is here. It's going very much to her right side. So when I pinch her nose and lift, and I decide where I want the new line of light reflex to be in the middle of the nose, this is also an important test to do, and important in your mind's eye to decide we're going to place a line of filler all the way down from the top to the bottom. That's where light's going to hit, and it's going to improve where the current light reflex goes off to the side and needs to come to the middle. So those are kind of the tips and tricks for marking. And then after a while, I think that I do this very subconsciously. And if you've done 100 noses, 200 noses, you will too. But until then, you're going to draw it, you're going to mark it, and it's going to make your injection process so much better. Now I know I need to build the hump, I need to hide the asymmetry, I need to create fullness here, and then I need to project. Those are the steps. No, Arlette's going to tell me, but thank you.
3,
Smile big.
2,
We took pictures of her smiling. Those should be your
1.
befores. Okay, close your eyes now. And then we're going to do step 1. So all the things we talked about. Step 1, the dorsum, fixing the hump. I'm occluding those arteries. I'm going down to the bone. I'm going to aspirate now. The rest of the day I'm going to have to aspirate every single thing because the universe was telling me something. Aspirate and then inject. And today we had a positive aspiration on one of these injections on a previous patient, and so important because you tend to get a little confident, overly confident when you've been doing a few of these, and when you feel like people tell you you can do whatever you want on the midline, on the periosteum. That is just not true because, especially in a post-surgical patient, they may have had some scar tissue, some tissues removed, blood vessels grow aberrantly, and aspiration is a way to make sure that you protect yourself and protect the patient, most importantly the patient. So we're first fixing the dorsum, and I'm doing vertical retrograde boluses of filler. I'm going down to periosteum, I'm aspirating, I'm checking for every flash of blood, and then injecting retrograde vertical columns as I come up. That gives me height versus injecting a bolus or dollop of filler down on bone, which gives me a broad, wide nose, which I don't want. I'll take the next one. Okay, great. Now we're going to come to that point called the rhinion, which is the junction of the bone with the cartilage, where always there's a dip right in here, and always there's some blood supply. So first palpating gently, seeing, do I feel a pulse? No, I don't. And then secondly, coming in, and it's quite a superficial bolus, but I'm going to go deep to where I feel the edge of that periosteum, and then very small aliquot, like a 0.2. We don't want to enhance the hump. And sometimes I've done that where a bolus there makes the hump look fuller, and it's nothing to freak out about, but you will need to flatten it, and then conversely you'll need to build the dorsum again to hide the hump more. So, and now we are going to come over to the tip of the nose. So that's step 1. Now that really accentuates now where she has an asymmetric bulge of the cartilage, of the bone here. Bony dorsum bulges here. And so now we're going to work on first palpating. This is the supply of the angular artery coming across here, dorsal nasal coming up high. So I palpate, I don't feel much, but I do feel a light. I actually do feel a light pulse on her there. So I'm going to give 2 small injections directly on periosteum, small amounts to hide that hump. And then I'm also going a little bit more at a diagonal versus straight perpendicular. The reason being because I'm trying to broaden the nose in this area slightly. I don't want a broader nose, but I do want to hide this bulge. Let's do the same thing on this side, but less so. She doesn't need quite as much width. And this is those blue lines that we drew in our drawing where we're trying to create dorsal aesthetic lines. Next step is going to be coming down below. And now let's play with the pliability of the tip of the nose and let's adjust the position. Where would we like the tip to go? Let's see, are we still good, Arlette?
Yes.
And how about you, Saf?
Yes.
Okay, we're coming in here, hitting the cartilage and skiving upwards, and then using the needle to tent the tissue up where I can see a blanch. That's not a vascular issue, that's me compressing and deciding how big of a bolus and what direction to place it to make the most elevated and beautiful angle to that tip. And I'm using a fair amount of force with that. You can actually even see that my needle tip here is angled upwards. I like to go, well, I started with a straight needle, but I've used enough force to have the needle bend itself a little bit. I also like to go bevel up with that because then I can really clearly see where the bolus is going to go. So that's created a very nice tip definition. That itself hides the hump nicely, and then we'll do one more droplet on this side. 1, 2, 3, breathe. Okay, I'll take another quick one. And then I'm going to kind of finish so that you can get your video. Stay where you are. Okay. Look up with your eyes right there. Look up again and keep them eyes open for, we're going to count to 3. And then we're going to do one more round where you're smiling. Smile. Go ahead and give a good smile. That's such a big difference. Wow. So the tip no longer droops with her pretty smile, and I think that looks really nice. Okay. When you're ready, you can fix. Okay, she has a protrusion here of her lower lateral cartilages and the columella. I would love to be able to fix that, but that is a surgical issue. There's overhang, columella overhang. And the best way to camouflage that is adding more to the tip. So we can add here, where her tip is a little flattened, and then also just up above at the super tip area. So 2 spots that can improve that. So let's add a little more of a bolus. And then we can only add a certain amount to the tip because she does not have that much pliability there. Hitting the bevel up. And the bolus here, they're small amounts. 0.05, not a big, huge bolus. You don't want a bulbous nose. You want to use the minimal amount of filler possible. It's all about conservation approach and really small amounts. Now I'm adding a little bit here at the bottom of her dorsal hump just to kind of give a smoothness to hide where her cartilage was a little irregular. And our last step is going to be Botox. I can see where she's going to need more at her hump. I'm not a fan of overfilling and overcorrecting this on the first visit. I really feel like they need 2 sessions, so it'll look good. Swelling will go down, the hump will come back slightly, so don't be surprised, but that's what the follow-up visit is about, final touches and making sure it looks really good. All right, how is the sensitivity and pain so far?
It's good.
Not
I
bad.
don't really feel anything.
Okay, great. Our last step is going to be looking at her from the front view. I can tell she's still a little hollow right in here. And of course this is like a super danger zone where angular artery branches can cross. So we palpate, we aspirate, and then we also pray a little. And that's because we don't have x-ray vision. We have to be very, honest and true to what we do. We tell the patient, we do our very best, and we just make sure we don't do anything high risk. And then I feel that her radix is still deep. And so the ideal angle here is, right now it's 150. We wanted about 120. So I'm going to add a little bit more there. And then you can tell, like, when we stretch her skin here and shorten that angle a little bit more, it looks even better. But that'll be on our follow-up visit. Let's do the tox under the nose. When she smiles, do a big smile. Much better. Before she had so much hooking and downward pull. And now this is going to help the Botox here at the base of the nose to help the muscles to not pull downward. Okay, good. 2 units. I'm going to put some in her procerus because she does frown and bunch up here, and that creates this nasal crease. I think you're gonna like it.
Oh my god. I look like a different person. Thank you.
It's really cute.
Oh my god, that looks so great. What a difference.
What a beautiful difference. So
Yeah.
your brain wants
I
to
used to have to do that to get that. I used to have to like, man, this is so really good.
Yeah, I love
So
how it
straight.
softened your face. It
Yes.
just looks really feminine and very pretty.
Yeah.
And no more hump.
Looks so good. And you said it's going to look even better after the second?
We'll do a 30-day follow-up. That
Nice.
gives time for swelling, bruising, and everything to settle. And so looking from her front view, the hump is better. That bony spur, which was quite asymmetric and prominent, is now much improved. I would say her dorsal aesthetic line is better. Still a little hollow, but we can add to that later. And her tip defining points are really good. Beautiful.
That's good. I love it. Thank you so much.
Of
That was
course.
fast.
All right.